Tendinitis of the knee is common in people who bend the knee frequently. When the pain starts gradually without an injury or a trauma, then the cause is most likely a tendinitis. So, if your doctor diagnosed you with Patellofemoral Syndrome or IT band syndrome and told you to do exercises, this video is for you. Patellofemoral Syndrome is pain in front of the knee. IT band syndrome is pain on the outside of the knee. Both are aggravated when you squat, run, jump, or go up and down stairs. If you sit too long, like in a movie theater or an airplane trip, the pain starts immediately after you try to strengthen the knee. This is a sign of Patellofemoral Syndrome, also known as jumper's knee or runner's knee. The treatment is very simple with some home-based modalities and exercises. So let's talk about knee tendinitis today. When the pain started with an acute injury, there will be swelling, redness, and pain. This is most likely a meniscus or ligament injury. It is different from tendinitis. In tendinitis, there is no swelling, no redness, no acute injury. The pain comes and goes and is aggravated by certain movements. Usually what starts a tendinitis is repetitive movements of the knee. A person that started training for a marathon or jumping or walking long distances. The patella is the kneecap. This is a small bone in front of the femur. When we bend the knee, the patella moves in this group up and down. If there is a misalignment of the knee, like knock knees, then the knees tilt inward. We call this genovalgum. When this happens, the patella will move outside of this groove, and this will cause pain and a condition that is known as chondromalacia patella. This means that the back part of the patella softens, and there is a feeling of grinding when the knee bends. The diagnosis is made based on the typical symptoms and some maneuvers in the physical exam. One of these techniques is applying pressure on the patella while the patient contracts the quadriceps muscles, and that reproduces the pain that the patient is complaining about. To fix patellofemoral syndrome, we need to bring the patella back to its groove, and the best way to do this is by exercising. Some people suggest taping the patella. This involves applying tape to the skin, pushing the patella inwards. This method could be useful in the acute phase, but it's not a long-term solution because this does not correct the cause of the problem, which is muscle weakness, tightness, and misalignment. Also, in the acute phase, the person may apply ice many times a day to reduce inflammation and pain. But ice is recommended up to until 7 days after the pain started. They can also apply some topical creams containing analgesics or take an anti-inflammatory pill for the first few days. Before I continue, let me remind you that this video is for educational purposes only. If you have a condition that needs medical advice, please talk to your doctor. And if there is an emergency, go to the nearest emergency department or call an ambulance. I tell my patients to do these exercises daily for a couple of weeks until their symptoms improve. Then they can reduce to 2 days a week for a few months to maintain the patella in its groove until the cartilage heals. There are 8 exercises in total. The first 4 are for strengthening the muscles and the last 4 are for stretching the muscles and tendons around the knee. Each person is different, so I recommend you to talk to your physiotherapist and check if these exercises are appropriate for you or not. In the description of the video below, there is a link to this document that you can download, and it summarizes all the exercises in this video. What you need to do these exercises is a mat, a towel or bed sheet, ankle weights, a roll like this to put under your knees, and resistance bands. I'll put a link to these products in the description of this video below if you want to purchase them. So the vastus medialis oblique or VMO strengthening. The vastus medialis is one of the heads of the quadriceps. In people with patellofemoral syndrome, this head of the quadriceps is weak and the other heads are normal or stronger. All 4 heads of the quadriceps attach to the patella tendon, and they pull the patella up when we walk. If the vastus medialis is weak, then the patella will move to the side and will rub against the cartilage and cause inflammation. We call this chondromalacia of the patella. So to correct this imbalance, we strengthen the vastus medialis oblique, or VMO. But how do we strengthen only this head of the quadriceps if they are all activated as a group when we use the quadriceps? Well, that's true. But the vastus medialis is the main muscle that is most active when we are bending and strengthening the knee in the initial 30 degrees. So from 0 to 30 degrees, basically, we are only using the VMO. The other heads of the quadriceps will get more involved once we pass this 30 degrees of knee bending. So let's use this knowledge to our advantage. We will do the exercises that bend the knee in this range. We can do this sitting in a chair, start without any resistance. Then you can add some weights to your ankles. And as you progress, the VMO will get stronger and stronger and will start pulling the patella to the groove again. This takes weeks, sometimes months, so you will not see immediate results. You may start with 8 repetitions, may increase to 12 repetitions, and then 20 repetitions. You may use this worksheet that I developed that has all the list of exercises. And here you can monitor your progression by checking the boxes, and you can download this worksheet in the description of this video below. So we can attach some weights to our ankle. Here I have my ankle weights. These are 2.5 pounds or 1.1 kilograms. So what you do is you attach, you can attach any weight. You can do like bean bags at home. And then you attach to your ankle, because now when you bend and straighten your knee here, you will be doing this with resistance. And then you can do 8 repetitions, increase to 12, and then increase to 20 repetitions. The more you do, the stronger the vastus medialis will get. Another way to strengthen the VMO is lying down. So you add a towel or a foam roller under your knees. And then you're going to straighten and bend the knee, and you do this repetition 8 times. You can do both at the same time. And you see here you are moving only 0 to 30 degrees. When this becomes easy, you're going to attach ankle weights. And these ankle weights that I have here are 2.5 pounds or 1.1 kilograms. And I'll put the description if you want to purchase ankle weights. I'll put descriptions in the video below. And then you do this with resistance now. So here, straight and bend. And if you do this 8, 12, or 20 times, the more weights you put on your ankle, you can do less repetitions. And you are doing this for the vastus medialis mainly, which is this head of the quadriceps here. So you can squat on the wall or on the floor. Let's start with squatting on the wall. Place your back against a wall and walk your feet forward and slowly slide your back down the wall until your hips, knees, and ankles are all at 90 degrees. Your knees should be directly over your ankles, and your legs should be parallel, and your kneecaps should be pointing forward. So keep your spine neutral, touching the wall. Your hands on the wall or on your waist. Your head up, your eyes looking ahead. And you stay in this position until your muscles start shaking. And you may count how many seconds you are able to hold, and you will see that you are progressing and you notice that you can hold longer. So now let's do some squats on the floor. Your legs are parallel to each other, the feet flat on the ground, the knee pointing forward, and we start with 8 repetitions, and we may increase this to 12 or 20 repetitions. And if you want to challenge a little bit, when you are lower here, you may hold for a few seconds and up, and repeat this a couple of times. If you lose your balance, you may hold on a chair or a countertop and do your squats. This is strengthening of the muscles, especially the quadriceps, but also the hamstrings and all the muscles of the thigh. So you may do these squats using resistance bands, and I have these ones. They're different colors because they have different resistance. So they go from, this is light, let me see, yeah, this is extra light, and then the next one is this one. This is light, the red one is heavy, and the black one is extra heavy. So I think I'm going to do with the light one, and you just put the loop band. This is a loop resistance band. You put it around your knees on the maybe 10 centimeters above the knee, and then you do your squat. Again, your legs parallel, the feet flat on the ground, and when you lower, you stay here for a few seconds, and then you try to open your knees. So you are doing resistance, and then you can do your squats with a resistance band. That is to challenge your knees a little bit more. As you progress, you will see that you're able to do more repetitions and put more resistance, and also hold here for longer. The other exercise that is important is to strengthen the hip abductors. Those are the muscles that do this movement here. And basically what you do is you lie on a comfortable mat, a firm one. Put your hand here so you don't lose your balance. You may rest your head in a pillow, and then you raise the leg, straight leg, and your toes pointing down, and you do this 8 repetitions. And when this is easy, you may attach weights to your ankle, and you may increase the number of repetitions to 12 or 20 repetitions. So this is a strengthening of the abductors of the hip, and those are mainly the muscles here in the gluteal area, gluteus medius, piriformis muscle, and gluteus minimus. They all do this movement of raising here your whole leg up. So we also need to strengthen the adductor muscles, the hip adductors. These are the adductor magnus, and they're all big muscles here that they close the thighs. So how do we do this? How do we strengthen this muscle? So there is a way that we can do this. You put one leg in front of the other one. So the lower leg, the one that is down there, is going to raise. So when you do this, I'm strengthening the adductors of my leg that is lower there. And you do this 8 repetitions. You can rest your head here on a pillow. You hold here so you don't lose your balance. Try to stay like a straight line. Your whole body is a straight line. So one leg in front of the other one. So the lower leg is going to raise like this, and you do this 8 times. You can also attach weights to your ankles to increase resistance. And then you can start increasing the repetitions to 12 times and 20 times. So these muscles, the adductors, they work in conjunction with the vastus medialis oblique, because they are in the inner part of your thigh. So it's really important to strengthen all of these muscles. There are various ways to stretch the hamstrings. These are the muscles behind the thigh. The biceps femoris has two heads, and bi means two. It is on the outside of the thigh, and the semimembranosus and semitendinosus are on the inside of the thigh, all on the back. These muscles, they originate in the ischial tuberosity, which is in the pelvis, and they attach to the fibula and the tibia, respectively, in the leg. So these muscles, they cross two joints, the hip and the knee. So to stretch these muscles, we need to move these two joints, the hip and the knee. People who spend too much time sitting have these muscles very tight. I have a lot of tightness of these muscles because I spend a lot of time sitting in front of a computer. I recently got a standing desk so I can straighten my knees when I'm working. Drivers, taxi drivers, truck drivers, they have a lot of tightness of the hamstrings. So we can stretch the hamstrings standing up and bending to touch the floor. I'm very tight, as you are going to see. So by doing this, you're stretching the muscles behind the thigh and try to touch the floor. I can't. So when you do this, you're stretching both hamstrings, right and left, at the same time. The other way of doing stretching of the hamstrings is if you're doing a mat, and we'll do this sitting here. This stretch is good if you have some back problems, and you may prefer doing this sitting or lying down. So sit on a firm surface and stretch down, trying to touch the tip of your toes. Relax your head so you feel stretching all the way here. And you can do this for both legs at the same time. And you hold for 10 seconds. You see I'm very, very tight. I need to do more of this stretch. The other way is you can do one leg at a time. So you bend one, and then you do with one. And make sure that you feel all these hamstrings stretching here behind you. And the other leg, so you bend one and go. And stay here for 10 seconds, and you'll be stretching the hamstrings. And the other way of doing stretching of the hamstrings is with a bed sheet. So this is if you are waking up in the morning and you want to do your stretches of the hamstrings, or if you are in bed, lying down. So always bend one leg, and the other one, you put a towel or a bed sheet here, and then you just raise it up, up, up. Make sure that the knee is straight. The ankle is 90 degrees. And you can do this. So here at the end, you can pull a little bit with your hands, and that will stretch. You have to feel the stretch here in the back of your knee. So you can do this 8 repetitions, increase to 20, or you just hold for 10 seconds and you feel the stretch, and that's good. You're stretching the hamstrings. So now let's stretch the quadriceps muscle. This muscle has its name because it actually is 4 muscles connected to one single tendon. Quadri means 4. When we stretch the quadriceps, we are stretching all 4 heads of the muscle. The vastus lateralis, the rectus femoris, the vastus medialis, and the vastus intermedius, which is below. So you grab your ankle behind you and you pull it backwards, ideally touching your heel on your butt. The rectus femoris crosses the hip, so if you want to stretch this head of the quadriceps, you need to pull the hip backwards. So this is called hip extension. You hold this for a few seconds, and if you think you're going to lose your balance, you can hold on a chair or on the countertop. And there is another way of stretching the quadriceps that is lying down on a mat, and I'll demonstrate that next. So the other way of doing a stretch of the quadriceps is lying down. So find a firm surface like a mat, and then you grab your ankle here. Make sure you relax your head, and you bring the ankle towards your butt and try to pull it here. And if possible, raise a little bit the knee from the floor or from the mat, because remember, this muscle, the quadriceps, is in front of the thigh and it crosses the hip and the knee. So it's good if you can extend the hip and bend the knee. So you're doing stretch of the quadriceps. This is another way of doing it. So I'll demonstrate the iliotibial band stretch. The iliotibial band is on the side of the thigh. It looks like a thick tape that starts at the hip and crosses the knee and connects to the tibia below the knee. The bone, the tibia is the bone in the leg. The IT band is important because it stabilizes the hip and the knee when we are walking, running, or jumping. It may get tight and inflamed, and the IT band syndrome is commonly seen in runners, cyclists, and people who walk long distances. And there is pain on the side of the knee, outside of the knee. May also have pain in the hips and knees, but mainly the pain is on the outside of the knee. And especially they feel this pain when they're going downstairs, when they're doing movements that bend the knee or high impact activities. So I'll show you how to stretch the IT band standing up. I recommend you to do this for both sides, but we'll start with the affected side first. So let's say that the right side is the affected, the painful side. So what we'll do is you put your right foot behind the other one, and now you start bending your body to the opposite side, so you feel stretching here. And you may even raise your arms and hold this position for 10 seconds. Don't forget to breathe and come back. And then you can do for the other side. Put the other foot behind and start stretching, 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 and go this way. There is another way of stretching the IT band, which is sitting on a mat, and I will demonstrate that for you too. So this is another way of doing a stretch of the IT band. Let's say that this is the painful side. So what we do is sitting in a mat, a comfortable mat. You're going to cross this leg to stretch, to put some stretch here a little bit. And then with your elbow, your arm here, you're going to force here to stretch. And the higher you go here, the more stretching you're going to do. This is the side here. Imagine here is the stretching. Put your other hand here so you you support your trunk and go. And you can start by doing this 10 seconds. And if you bend your body to the other side or just relax here. So here you are stretching for 10 seconds your IT band, and then you relax. You can do to the other side. I will not do because then I'll give my back to you. But then you can repeat this again, cross the other leg and pull and count to 10. So now we are going to stretch the adductor muscles. Those are the muscles in the inner thigh. We have the adductor magnus, longus, brevis. So these are main muscles that they close our thighs. And we need to stretch them because if they are tight, they may also be interfering and causing pain here in the knee. So the way you do this is you bring your feet together here, and we'll do the butterfly stretch. And just if you are tight here, you may help with your elbows, but just let gravity relax your adductor muscles. You may do some butterfly here, or just let go and breathe and hold here in this position maybe for 10 seconds. And when they are very stretched, they might be able to, your knee may be able to touch the ground there, but if not, it's okay. Just keep doing this exercise daily and you will see that with time, these muscles will be more stretched, and you can progress. You can make it more challenging by bringing your heels closer to your body. And if that's too hard for you, you can leave your heels over there and stretch these muscles. So to prevent this pain from coming back, you might need to correct some activities that precipitated the pain, like running, jumping, or squatting. It is a good idea to maintain a healthy body weight to avoid too much pressure on the knees. Talk to your doctor if your symptoms persist, and remember that some people develop chronic pain because of anxiety and fear. If that's your case, talk to a mind-body therapist to help you treat this fear of pain. If you like this video, give a thumbs up here and don't forget to subscribe to this channel. And thank you for watching. Goodbye!